Come see us on tour. We're going to be in Baltimore, Hartford, Connecticut, Syracuse, Atlantic City, Levittown, New York, Cohoes, New York, and Providence, Rhode Island. Go to jimmydore.com for a link for tickets. This lady here was the coronavirus coordinator for the White House.
Yes.
And she's going to make two shocking admissions. And turns out the conspiracy theorists were right again. Here she is. Let's listen. By the way, I like how she has very interesting things to say, and it's very important. But Piers Morgan has her squeezed in between the creepy rich guy who gets blood transfusions from his son and Grant Cardone, the get-rich-quick scheme guy being looked at for fraud by the feds. Here we go.
The messenger RNA vaccine should have been rolled out for the people that were at risk for severe disease, because that's what the vaccine was developed for. But when we say that we're following the science and the data, we need to follow the science and the data. And the science and the data said people primarily over 65 or people with significant comorbidities were at risk for severe disease. Those are the individuals that should have been immunized first. And we should have put our science behind our immunization schedule and protected those most at risk. It went into young people.
So it sounds like she's advocating for the Great Barrington Declaration, which everybody from Fauci and Collins and every person in mainstream news media called them crazy, called them fringe. Fauci called them fringe. And by the way, great job of sounding the alarm now. It's 2025. She's finally you were in the White House when they did this policy. Why didn't you scream then? Hey, this should be just targeted towards senior citizens. You shouldn't be putting this in children. Why didn't she say that then? She's saying it now.
The perfect time, Jimmy. Piers, Dracula, Scientology guy. I want to tell you, I want to let the whole truth out now.
People in hospitals before it went into our elderly and nursing homes. That is not following the science and the data. So I am all for following the science and the data, but it shouldn't just be a statement. It should be a reality. And when we don't match what we do in public health to the science and the data, that is when we get into trouble. And that's when we start to fracture trust with the American people.
So what she just said was during the corona pandemic that the White House, the CDC, and the FDA and the WHO was not following the science. She's saying that right there. That's the coordinator of the coronavirus from the White House, from the coronavirus response. Let me get her direct title so I don't mess it up. She served as White House coronavirus response coordinator until March 2021. And if you talk to people who are actually trying to get something done in the White House, she was also a big impediment to it. But now she's coming out telling you the truth. Isn't it funny how she bit her tongue up until February 2025? Isn't that interesting that she bit her tongue all that long?
Yeah, and just started wearing a scarf after she saw her neck on TV.
And so why, I just really great idea to bite your tongue until you're put in a Piers Morgan 4-way.
Look at the Dracula guy. Does he not look like Data from Star Trek?
Yes, he does.
Next Generation. He has yellow
the messenger
skin.
RNA.
So, and why did they target? Why did they give the vaccine to everybody? Like she said, that was a mistake. They should have did it targeted, which is exactly what Dr. Jay Bhattacharya said in the Great Barrington Declaration, who is now the head of the NIH, Dr. Jay Bhattacharya.
Is it because F you,
yeah,
as the great Joe Scarborough would say?
So now here is Dr. Paul Offit. He says Fauci knew that not everybody needed the COVID vaccine, but they all recommended it anyway, including him. Can you look up what his official title is?
Okay. But he's not the guy that resigned.
He's a leading
over the boosters.
No, he did not resign.
Oh, okay.
So listen to what he said. Why? So there's the coronavirus response coordinator under Joe Biden and Trump, saying that we didn't follow the science. She's saying that we didn't follow the science. And now people don't have, because vaccine hesitancy doubled after coronavirus. Doubled. And she's saying, well, it's because we didn't follow the science and we should have targeted it towards the elderly and people with comorbidities. But instead we gave it to everybody. And so why did they do that? Here's Paul Offit to tell you that Dr. Fauci told him. Watch.
Well, I saw Dr. Fauci at a meeting maybe a year ago or so, because I was already getting out there saying I think we should target high-risk groups, where I was getting a lot of pushback from public health people who felt that I had gotten off the bus. Because, see, that was the whole feeling in this. You're either
so watch what he said.
On the bus or off the bus. And there was no.
So you're either on the bus so if you're on the bus, that means you go along with everything Tony Fauci says.
Yeah.
And if you question it, you're off the bus, and we will do to you what we did to Robert Malone. Do you want that happening to you? Do you want us to have smear pieces written to take you down immediately, like we did to Jay Bhattacharya, like we did to all the people at the Great Barrington Declaration, like we did to Robert Malone, like we did to, who's the other guy, the heart, I can't think of his name. Yeah, McCullough. Like we did to those guys, like we did to Pierre Corey. Like,
Jimmy,
so if you're off the bus, meaning you're going to question and push back on what they're doing because you know it's not scientific. And he's saying, he's claiming.
Hey, did you change your name to On It?
Yeah, it's not Paul.
Paul On It?
Oh, in between. So I got.
Yeah.
I said, Tony, am I wrong? Am I wrong in making? He said, no, you're right. We should target high-risk groups. He said.
So he asked Anthony Fauci, am I wrong? Should we target high-risk groups instead of giving it to everybody? And Anthony Fauci said, no, you're not wrong, but we're still going to recommend the vaccine to everybody from babies to the 100-year-olds. Why? Listen to the reason why.
The problem is, the minute you say that, it becomes a nuanced message. And a nuanced message is a garbled message. If you really want to make sure those groups get vaccinated, then you recommend it for everybody.
Jeez.
And okay, so if we think that, we should say it because my personal thinking on this is.
He's saying that Anthony Fauci said, you're not wrong. We shouldn't recommend it for everybody. We should recommend it for targeted people who are over 65 with comorbidities. But the minute you do that, according to Anthony Fauci, the message gets garbled. Jeez. So we don't want to garble our message. So we want to go against the science, lie to people, and recommend it for everybody. That's what he just said.
You see, Jimmy, it's like people are like dogs that you put their heads in a thing with the sand flies there.
Yes.
You just do it. There's no room for nuance.
So that's what he's saying right now. Hang on.
Then that's the reason we're vaccinating healthy 16-year-old boys. That's not a good reason. And
let me back that up.
And okay, so if we think that, we should say it because my personal thinking on this is, then if that's the reason we're vaccinating healthy 16-year-old boys, that's not a good reason. And
so if the reason we're vaccinating healthy 16-year-old boys is because we really want the targeted group to take it, but we have to lie and make 16-year-old boys take it. He's saying if that's the reason is you're afraid it'll be a garbled message, even though they don't need it.
Yeah,
that's not a good reason to make 16-year-old boys get a vaccine. He's saying that. What is Paul Offit's?
His
now that he's
position,
off the bus.
Yeah, now he's really off the bus.
Okay, Paul Offit. Hold on, I just had it.
Where's the bus going?
Paul Offit, he was an American pediatrician specializing in infectious diseases, vaccine, immunology, and virology. And Offit is a member of the Food and Drug Administration, Vaccines and Related Biological Products Advisory Committee.
There you go. Okay.
Just have it open. Say it openly. You know what I'm saying? Because I think people are smart enough to hear it.
So he's saying, don't lie. Starting now. So he didn't get off the bus until now. So again, he's another one of these guys. Oh yeah, you're right. All the people who questioned it, They were right. And I'm going to say it now because it's obvious now to everybody that we were all lying and that we weren't following the science.
Yeah, he's a real Albert Speer. You know, the good Nazi that said he was sorry.
And why is he smiling through this? He can't stop. They're all smiling. So I'm going to play it for you without stop. So this woman just got done saying the former coordinator for the White House COVID response under Trump and Joe Biden said that they should have targeted the vaccine just to people over 65 who had comorbidities, and it was wrong. We didn't follow the science. That's the Joe Biden's coordinator for coronavirus response saying that.
What are you going to do?
Now,
that smile, you know what the smile is? It's called Duper's Delight.
That's right.
No body language.
And here's the guy from the FDA to tell you why they told 16-year-old boys and people and pregnant women to get that COVID vaccine. Here's why.
Well, I saw Dr. Fauci at a meeting maybe a year ago or so, because I was already getting out there saying I think we should target high-risk groups, where I was getting a lot of pushback from public health people who felt that I had gotten off the bus. Because, see, that was the whole feeling in this. You know, you're either on the bus or off the bus, and there was no in between. So I'd gotten.
Yeah.
I said, Tony, am I wrong? Am I wrong in making? He said, no, you're right. We should target high-risk groups. He said, the problem is, the minute you say that, it becomes a nuanced message. And a nuanced message is a garbled message. If you really want to make sure those groups get vaccinated, then you recommend it for everybody. And okay, so if we think that, we should say it. Because my personal thinking on this is, then if that's the reason we're vaccinating healthy 16-year-old boys, that's not a good reason. And just have it open.
That is Duper's Delight. That's why
say it openly.
That is why he can't stop smiling.
Because I think people are smart enough to hear it.
Wait, can we go back to the thing Fauci said that you then just went along with?
Yeah, you just went along with it.
Oh, looking back now, it's not that. Hey, I'm still talking to idiots I know who they'll never even look at. They'll tell you cherry pick this. They'll never even look at it. That's the damage these idiots did. What a scumbag, man. Turkey neck's not cool either.
So there you go. There's the guy from the FDA saying Anthony Fauci was lying to you. There's the woman from the coordinator for Joe Biden's coronavirus response saying they were lying to you. They were lying to you. They weren't following the science. That's what they're saying. That's what Joe Biden's coordinator for coronavirus response is saying. And the guy, the premier vaccine guy, vaccinologist from the FDA, that's what they're saying. They're saying Tony Fauci decided to lie to you again. This goes against the narrative that we were all fed, that everyone needed to get vaccinated to protect grandma. Remember that? People lost their jobs because of this lie. 4 years later, they're reluctantly admitting that young people were never the intended primary target for the jab and that it wasn't even designed to prevent infection. How do I know it wasn't even designed to? Because she said so. Here's Joe Biden's coordinator for coronavirus response, and this is from 2022. And listen to what she says. He asks, hey, was the government lying when they said that the vaccine would stop transmission and contraction? Were they lying? Or were they just wrong? Here's what she says.
Wow. When the government told us that the vaccinated couldn't transmit it, was that a lie or was it?
So when the government told us that the vaccinated could not transmit COVID, was that a lie? This is what Jim Jordan's asking.
Admit it. Was that a lie or was that a guess? Or is it the same answer?
I think it was hope that the vaccine would work in that way. And that's why I think scientists and public health leaders always have to be at the table, being very clear what we know and what we don't know.
This is important for the country to know. So when I asked the question, when the government told us that the vaccinated couldn't get it, and I asked you if it was a guess or a lie, you said you don't know. You said you think it was hope. So what we do know is it wasn't the truth. So they were either guessing, lying, or hoping, and communicating that information to the citizens of this country.
So they were hoping. Boy, it wasn't, she didn't know. Hoping. Yeah. They certainly weren't. didn't seem that unsure when they were locking you down and mandating experimental medical treatments for you, right? They didn't seem unsure or hoping. But the good news is she got away with it scot-free.
Yeah.
So did Anthony Fauci. So did Collins.
Nothing will come of it.
So did that the guy Paul Offit. They all got away with it. They all lied to you, and they all got away with it.
I'd smile too. I'd treat myself to a little bit of duper's delight after pulling that off.
They all lied to you, and they all got away with it. And don't you think someone should go to prison? I think someone should go to prison for this. They knew they were lying to you. People got kicked out of college because they wouldn't take the mandated vaccine. People lost their jobs because of it. We locked down people.
Yeah.
41% of black-owned businesses shuttered. 70,000 healthcare workers in New York alone got fired. And they always knew they were lying. They always knew they were lying, and no one's going to jail for it. I don't think it's that ridiculous to think. I think it actually makes sense that someone goes to jail.
Yeah.
For lying.
I'll tell you what, yeah.
People, pregnant women were taking it. Pregnant women.
Yeah, my sister put it in her kids. Hey, you know what really gets me is the way they preyed upon my innate love and trust of consensus this way. Being on the bus and off the bus. We all want to be on the bus.
So when they said vaccinated people couldn't transmit the virus, it was a hope that they couldn't. Not that they actually had any science.
Well, and you didn't believe enough. Boy, this sounds like a faith healer, don't it?
Yes.
You must have not had enough faith. Don't lose faith in science, Jimmy. You should only have more faith in science.
Here's the former CDC director, Robert Redfield, and he's going to tell you about all the ways Anthony Fauci lied about when he talked about herd immunity. Watch this.
And I remember one story that Tony had told
Anthony Fauci
people that once we got to 30% immunity, we'd have herd immunity.
So first, Anthony Fauci said, once we got 30% of the people vaccinated and to immunity, we'd have herd immunity. He said 30%. That's where he started. And then
pandemic would be over.
And the pandemic would be over.
And then later he told people that it was 50%. And then not much later, maybe a month or two later, he said 70%. And I remember a reporter that was kind of with it said, Dr. Fauci, what scientific data came in between the last time when you said it was 50% and now that you said it's 70% that made you change your mind? And I kid you not, it's a matter of record. Tony said, there is no new data, but when I told you 50%, I just didn't think you were ready to hear 70%. And this is where I come back. Public health leaders just have to tell the American public the truth. Just tell them the truth and let them make the judge. Don't try to package the information in a way that they will decide what you want them to decide. And that's what happened here.
So now Anthony Fauci, we know for a fact, lied about masks. He lied about who should be targeted with the vaccine. Lied. He got all the people around him to lie because you can't be off the bus. Because if you're off the bus, they'll smear you like they did to Dr. Robert Malone, Pierre Corey, Peter McCullough. They'll smear you, get you fired, get your credentials revoked. That's what they'll do to you. So you don't want to be off the bus. So they all lied. Paul Offit lied. Deborah Birx lied. Tony Fauci lied. They all lied. And then everybody on TV. And that's why
it's their job.
And that's why all our friends are such morons still to this day. Still calling ivermectin horse paste. They're still doing that. And
they haven't even followed the propaganda up to the date. They're not even following the current NIH recommended propaganda.
And now here he is, the former CDC director, saying Anthony Fauci lied over and over about herd immunity. Lied. And he said, they asked why he lied. Well, I just didn't think you guys were ready to hear the truth, so I lied. That number one health guy, if you lie once, you've lost everyone's trust. Now you have to go. Because now we'll always question everything you say, which we were right to question. because
Look,
he was lying. Anthony
Garbling
Fauci,
the message, would you say?
Yeah, he was lying.
Yeah. Nuance is the problem, not outright lying. Of course, that makes perfect sense. That's scientific sounding, as a matter of fact.
There was a proactive decision that anything that suggested that vaccines didn't work would somehow maybe push people not to get vaccinated. So therefore, we were going to oversell the vaccines. The vaccines clearly were oversold. They should have never been mandated. People should have never lost their jobs or livelihood. The senator knows. I feel that we really, I think the intent in making no liability for vaccines when they passed those laws was well intended, but it doesn't work. These companies have to be able to be held liable for their products like any other company. And hopefully Congress will change that so that these companies that make these vaccines that do have vaccine injury, people can get, compensated for the injury they suffered, particularly in a situation which was so inappropriate where they were mandated to get this vaccine, even if their instincts were not to get the vaccine.
And now everybody sounds like RFK Jr. Isn't that amazing? They all sound like RFK Jr.
Well, he said that before. We played him before saying this back when nobody said it, right?
Yes.
I remember this. Yeah.
Yeah. And here is Dr. Fauci being asked, why did you lie about herd immunity? She doesn't even get it right that he's first said 30%, then 50%. They jump right to 70%. Watch this.
In terms of coronavirus, you acknowledged to the New York Times that you've moved the goalposts in terms of what it would take to reach so-called herd immunity in the United States. Here's what you said. You said when polls said only about half of all Americans would take a vaccine, I was saying herd immunity would take 70 to 75%. Then when newer surveys said 60% or more would take it, I thought I can nudge this up a bit. So I went to 80, 85. And then you go on to say that it may be as high as 90%. So my question is, why weren't you straight with the American people about this to begin with?
No, actually, Dana, I don't think it can be interpreted as being straight or not. We have to realize that we have to be humble and realize what we don't know. These are pure estimates, and the calculations that I made, 70, 75%, it's a range. The range is going to be somewhere between 70 and 85%. The reason
and so now he's pretending that it was always a guess, and I started at 70, which he didn't. He started at 30. Then he went to 50 and asked why he went to 50. He said, because I didn't think you could handle the truth. So he's not admitting to lying on purpose again.
Look, it's not like it matters because it was mandated anyway.
Yes.
So you never had a choice. So who cares what I said?
First started saying 70, 75. I brought it up to 85. That's not a big leap to go from 75 to 85.
No,
it was really based
bit.
on calculations and pure extrapolations from measles. Measles is about 98% effective vaccine. The COVID-19 vaccine is about 94, 95%. When you get below 90%.
He's still saying that the COVID vaccine is 94% effective.
I never got measles. I had that vaccine. I never got measles. I got COVID right after the COVID vaccine. So did everyone I knew.
And of the population vaccinated with measles, you start seeing a breakthrough against the herd immunity. People starting to get infected like we saw in the upper New York State and in New York City with the Orthodox Jewish group when we had measles outbreak. So I made a calculation that COVID-19, SARS-CoV-2, is not as nearly as transmissible as measles. Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85. But I think we all have to be honest and humble. Nobody really knows for sure. But I think 70 to 85% for herd immunity for COVID-19 is a reasonable estimate. And in fact, most of my epidemiology colleagues agree with me.
Yeah, of course. Nothing is exact. I guess my question was about polling. It seemed in that quote to suggest that you were basing your recommendation on polling and what people could accept. Is that not what you meant?
No, I mean, it's a bit of that. I want to encourage the people of the United States and globally to get vaccinated, because as many as we possibly get vaccinated will get closer to herd immunity. So the bottom line is, it's a guesstimate. I gave a range, and I use any discussion like we're having now, Dana, to encourage people to get to that goal of 70 to 85% of the people vaccinated. That's where we really want to be.
Okay, and just to put a button on it, no sugarcoating, you're saying 75 to 80% is the goal in your view as of now, based on what you know when it comes to herd immunity, not 90%.
Right.
Okay. Thank you. So
Don't sugarcoat it.
One more question. When does...
So you want to see him lying? So here's those two people. She was the coordinator for coronavirus response under Trump and Biden. Here is Anthony Fauci. Watch this.
You should care, because if you get infected and you're not vaccinated, there is a chance, maybe a likelihood, that you will be part of the dynamics of the continuation of the chain of transmission. Namely, you will inadvertently or innocently transmit it to someone else, who will then transmit it to someone else. And I don't think anyone would intentionally want to be part of the transmission chain. You want to be a dead end to the virus. So when the virus gets to you, you stop it. You don't allow it to use you as the stepping stone to the next person. So those are the things that we ask people to consider, not only your own health, but your societal responsibility.
We only knew if those vaccines protected against severe disease and hospitalization. We didn't study silent infection. People were not tested without symptoms on those trials. I don't know how it got translated that these vaccines would protect people from infection. It was wrong then. It is wrong now. It's potential that you can make a vaccine better than natural infection, but it's very hard to do.
Wait, Jimmy, will you just play what he said instead of just saying you don't want to transmit the virus, which is what the thing was, right? Did you hear how long he took to say that?
Yes.
You want to be part of the chain of the something of the
and do your civic responsibility and
of the dynamics. That's unbelievable. That guy is like mocking you while he talks to you.
Yes.
No, I didn't say that, but I did say that. But I didn't say that. But no one is saying that. But definitely I am saying that. But that's not neither here nor there. The point is,
did you say
I'm
that,
not saying that.
Did you say you said something based on polling? It was a bit of that, but we have to be humble.
It was mostly I worship the devil.
It was a bit of that. A bit of polling? How much is a bit? Well, we have to be humble. We don't know. Yeah, but you didn't say that. You didn't say we don't know.
Yeah, we just said it was a poll, but no polling was actually done. We just made it up.
Come see us on tour. We're going to be in Baltimore, Hartford, Connecticut, Syracuse, Atlantic City, Levittown, New York, Cohoes, New York, and Providence, Rhode Island. Go to jimmydore.com for a link for tickets.